from the moment they have an abnormal mammogram, we try to rush them through the process, because I think, part of the problem is just not knowing. And so most of the time that when a patient has an abnormal mammogram, it turns out that we know 8 out of 10 of those patients that will be a benign condition, but the problem is not knowing. So we try to really expedite getting those patients through the process, getting them seen and getting their biopsy done as soon as possible.
The patients are opting for a lumpectomy and the sentinel lymph node sampling in the case of a clinically negative axilla.
In the old days, it was always felt that more surgery was better. Everybody had to have a radical mastectomy. More is not necessarily better. Now you don't have to have mastectomies, and we found that we can have the same outcomes with just removing the tumor itself and maybe a small area around it, just to make sure we have good margins, and that once the diagnosis is made with a needle, it gives us an advantage of being able to sit down in the office and really discuss the treatment options for that particular tumor with the patient right then. Historically, everybody had to have whole breast radiation. We do partial breast radiation now, where you can only have to have a small balloon catheter inserted and have your radiation completed in 5 days versus 6 weeks.
So we have nurse and patient navigators that will set up appointments for the patient, and physicians have agreed to see the patient the next day at the very latest. And so we can actually have a patient that's initially, say, has an abnormal mammogram, all the way to diagnosis and the overall treatment plan being set within a week. So it's been a really fabulous program to help patients work through the process and speed up the process rather than sitting at home and waiting for a week for the next appointment. Our control rate in the breast is over 99%. That we have only had 3 recurrences in the breast out of that 560 patients. And if we compare that then to major cancer institutions, teaching institutions where research is done, their local control rate in the breast is 95%. And again, ours is over 99%. And the national average, if you just look at an average across the country, is 90%. A tumor is removed from the breast, but the margins, meaning the surgeon's cut, is too close to the tumor, or maybe cuts through a little bit of the tumor. That's called a positive margin. Then, and there may be some question on the pathology report if there is an actual positive margin or not. Sometimes it's hard to tell. I might suggest to the surgeon, well, let's go back and get more margins.
Our results are as good or better than national averages, so I think right here's the place to get it.
I think that we can treat essentially every woman's breast cancer here in Dalton, where they don't have to travel far away. We have the same technology, the same abilities as large metropolitan areas and centers. So it's one of the diagnoses where you don't have to travel far away, and it's easier to get the care at home where you're close to your house, with really no difference in outcome between us and any of the larger centers. We talk almost seems like on a daily basis, where we can have coordinated care with the oncologist, radiation oncologist, the surgeons. We have cancer conferences that we will present patients at to make sure that everybody's on the same page, so that we can formulate their care specific to that patient and do the right thing.
We try our best to treat every patient as an individual and try to individualize treatment to their personal needs. We have regular meetings where experts from all fields, surgery, medical oncology, gastroenterologists, pulmonary, radiology, pathology, you name it. All these experts will get together. A good example is the tumor board. And we'll talk about patients, everybody puts their head in, we come up with a decision so that each patient can be provided with the best possible care that they deserve. Patients always have an input into their own treatment. Every decision that's made is made keeping the patient in mind. and they are the boss, they guide the treatment, we always respect their decisions.